Hey y'all, the lectures from yesterday never uploaded, so this is take 2 of chapters 8, 9, 10, 11, and a little snippet of 12. So we talked previously about the drugs that are going to, how each of these antibiotics are going to target the bacteria differently. Some of them are going to be bacteriostatic, and some of them are going to be bactericidal. And we talked about drugs that affect the cell. We talked about sulfamides first, and then we talked about drugs that affect, excuse me, the cell wall, which would be your penicillins and your cephalosporins and your carbapenems. Now we're going to talk about antibacterial drugs that interfere with protein synthesis. So at the end of the day, like we talked about, they are all, the overarching goal is to get rid of the infection, but how that happens, that's its mechanism of action. So the mechanism of action of all the drugs that we're about to talk about is that they interfere with protein synthesis. So just like us, in our body, when we're making DNA, we're building, our amino acids and our proteins, and all of that is linking together to, those proteins in our bodies are helping us to form the structures that we need to remain alive. The same thing is true with bacteria. If we can interfere with the making of the protein, then they can't go any further. They can't build amino acids, and they can't build anything else that they need to sustain life. So eventually they die. So the drugs in these drug classes are your tetracyclines, your macrolides, your glycosamides. Those are the biggies, and your aminoglycosides. So if you look on page 96, this is a pretty short chapter. Tetracyclines are going to be, they're going to be broad spectrum drugs that are used a lot of times when your patient is allergic to the penicillin drug class. When they're allergic to penicillins and cephalosporins, we're going to use tetracyclines. And then you have aminoglycosides beneath that. So back to the tetracyclines, I apologize. They end in cycline. So that's always nice whenever you can group your drugs like that. Your aminoglycosides, I'm going to post along with this lecture several little resources. And there's this little mnemonic, and it talks about Amy, and she has big ears, and there's little mice crawling on the floor, and you're like, what is happening here? That mnemonic just helps you remember that the aminoglycosides end in MICIN or MYCIN. They're closely related to the macrolides. Those are also going to end in MYCIN. They're a very similar drug class. Both drug classes can affect your hearing. If the drugs are at a toxic level, they are ototoxic, and they can also cause some neurological problems. So you'll look at those, and then beneath that is the glycosamides, and those are going to end in mycin as well. I'm not going to ask you a whole lot between those across those three drug classes because I know that they are so similar. But I do want you to recognize them as being drugs that interfere with protein synthesis. And then I just want to delve a little bit deeper into what we're given these drugs for. So we said they're broad spectrum. They're going to be contraindicated. So tetracyclines specifically, you do need to know this about tetracyclines specifically. We are not giving them to children less than 9, and we are not giving them with milk products or dairy products. There's a food drug interaction with those, with tetracyclines and milk and those types of products. So that's very important to know. Tetracyclines are not given to children younger than 9 unless their use is absolutely necessary, because these drugs may cause permanent yellow, gray-brown discoloration of the teeth. The use of tetracyclines, especially prolonged or repeated therapy, may result in overgrowth of non-susceptible bacterial or fungal infections. So years ago, a lot of people, we didn't know that it caused that discoloration. So children that were allergic to penicillin got tetracycline, and they had effects on their teeth later in life that were unknown at the time. So now, unless it's like a life or death kind of thing, or their infection is just out of control and no other drug option is sufficient for their infection, we're not giving them to children less than 9. I always think of Tetris. You played, I don't know, I'm old, y'all might not have, but I played Tetris when I was 9 years old, to kind of keep that in my brain. With birth control, tetracycline will cancel out birth control in a heartbeat. So you must educate your, people of childbearing age. You have to educate that that is a risk, and that additional contraceptives need to be used when taking tetracycline. As far as the aminoglycosides, nephrotoxicity, ototoxicity, and neurotoxicity. If we know that it can cause these 3 things, then we know that we need to assess their kidney function for nephrotoxicity. We need to assess their hearing. If they suddenly start telling you that they have ringing in their ears, they're not crazy. It's a big deal, and you need to take note of it, and you need to further investigate it. And with neurotoxicity as well, if you begin seeing any kind of neurological changes, any jerking or any changes in neuropathies, anything like that, we want to be mindful of that before it progresses, to be a much bigger problem. And then when you look at the lincosamides, blood dyscarias, or dyscrasias, I don't know why I said dyscarias. Blood dyscrasias are going to be a problem with that drug class. And with all of these drug classes, we talked about those super infections. We talked about how, bacteria is not always a bad thing. So sometimes when we give antibiotics, we're killing those good bacteria in our gut, and we're causing super infections. Pseudomembranous colitis resulting in C. diff, all of those things are potential with these drug classes as well. So those are the big takeaways from this chapter. Honestly, you'll have to know your nursing alerts. You'll have to know that if we see a hypersensitivity reaction, we're not going to wait till it progresses to the point of respiratory failure. You'll have to have your assessment. You really have to assess these patients and start looking, if they're having swelling of their lips, we're not waiting until they're, in a full-blown anaphylactic reaction. You have got to assess, and usually if those reactions are going to be seen, they're going to be seen always, but with initial, within 30 minutes of an IV or IM injection of these medication, and then within 48 hours if they're taking them orally. As far as ototoxicity, carefully evaluate the patient's complaints or comments relating to hearing, such as ringing or buzzing in the ears. The patient may report a sensation of stuffiness in the ears or difficulty hearing. If hearing problems do occur, report the primary care provider immediately. To monitor for damage to the 8th cranial nerves, an evaluation of hearing may be done by auditometry before and throughout the course of therapy. So that's, again, one of those things when we talk about our ADPI. I know y'all get so sick of me talking about it. But if we're not assessing our patients and we don't know their baseline, then, sometimes you can brush this stuff aside to say, oh, they're 80 years old, their hearing has always been bad. Not necessarily, not just because they're, advanced in age or their ear is bad. So you need to take all of your patients' complaints seriously, and you need to know what their baseline is so that you can better serve them. So just in general, we talked about tetracyclines. They are bacteriostatic, and they are the drug of choice when patients are allergic to penicillin or cephalosporins. The aminoglycosides, macrolides, and lincosamides are primarily bactericidal. And y'all remember the difference between bacteriostatic and bactericidal. And then all of those drugs discussed, the way they work, their mechanism of action, is that they interfere with protein synthesis of the bacteria. And that's really, those are the biggies. Make sure that y'all know your key terms, and make sure that you know the difference between, you know, how to assess for those adverse reactions such as ototoxicity and neurotoxicity. And that is the most important takeaways from Chapter 8. All right, moving along. I'm going to end my recording in case it decides it doesn't want to upload. So be back shortly.